It seems that a good portion of the criticism of North Carolina's Medicaid reform idea is that the state of Kentucky did something similar, but they had some problems with their implementation of their reform.
Yes, Kentucky did.
Tell us about that and how North Carolina is going about trying to avoid the problems of Kentucky.
Sure. Well, Kentucky in 2011, they switched to a statewide managed care program, and they too had 3 managed care organizations operating within this reform. The 3 major pitfalls that Kentucky faced, which is what caused the plan to fail, was one was administrative burdens. These were unnecessary administrative burdens that prevented providers from practicing efficiently. The second one was payment delays, and then the third one was just inexperience with timeline implementation and taking the proper incremental steps to really set up a quality system.
You have analyzed what North Carolina plans to do.
Sure.
So let's talk about what it is in our state's reform plan that would avoid those problems you just mentioned. First of all, problems with administration and billing and doctors and hospitals getting paid. Have you seen anything in the plan for our state that tells you that we are not likely to go down that road?
Yes. Well, for example, as far as the unnecessary administrative burdens in Kentucky, each of the managed care organizations had its own separate billing and coding systems. So providers became frustrated because nothing was streamlined. Everything was different, and they didn't know that it was different. And
so you had to have experts in all these different organizations and how to do all the paperwork.
So this resulted in payment delays or reduction in reimbursements because providers are also used to billing for 15-minute increments for a Medicaid appointment. And this is different now. It's just one bill for each appointment. But North Carolina is avoiding this frustration and confusion by streamlining all of the different MCOs, coding and billing systems into one financial reimbursement vendor.